I'd like to introduce Johnson McEvoy. He is a doctor, a chartered physiotherapist. He graduated with BSc in physiotherapy in the Trinity College, Dublin. He holds a master's degree in sports physiotherapy and a doctorate from the University of St. Augustine in Florida. He works as head physiotherapist with Amateur Irish Boxing since 2003, and he's going to give you a bit of an introduction to physiotherapy.
Great. Thanks very much. It's an honour to be here. And over the next 25-30 minutes, I'm going to talk about some of the physio aspects involved in boxing, particularly looking at prevention of injury and the cost of those injuries, etc. So it's a pleasure to be here. So we're going to talk about injury prevention, and we're going to focus on hands, shoulder, concussion, and then one other aspect which is quite interesting. Hands being the most important injury in terms of cost, time and performance, and the greatest risk. We'll talk about shoulders. Most shoulder injuries are not serious, which is good news. Boxers suffer a different type of injury than you see in contact sports like rugby, Gaelic football, etc. So we're going to delineate between those, and then we're going to look at concussion, which of course is the hot topic in sport at the moment. It shouldn't necessarily be a hot topic. It's occurring at the same rates as it did 20 years ago, but it's about identifying it, and that's where coaches play the absolute key role. And I'm going to show you the stats for that today. Right? So amateur boxing, is it a high-risk sport, do you think, for injury? No, not at all. It's actually a low-risk sport for injury. Actually, it wouldn't even rank in the top 10 most dangerous sports, if I may use the word dangerous. What do you think would be the most dangerous sport? Or possibly? Horse riding, equestrian. Yeah, rugby's up there too. And of course, if you take the extreme sports out, they'd be probably ranking high, like base jumping, that sort of adventure sporting. But equestrian, absolutely. Equestrian is probably the most dangerous sport. So amateur boxing, as we're talking about, is a lot safer than professional boxing in many aspects. Any reasons why? Maybe head guard usage specifically in training, and we're going to talk about head guards today. I know it's controversial, but we'll talk about that. Yeah, well, the scrutiny, absolutely. The scrutiny of amateur boxing, it really is a sport that other sports can learn from in terms of how it's medically controlled, etc. The other thing is it's 9 minutes. It's 9 minutes. Your exposure risk is lower. 36 minutes in a ring, you become very fatigued, you now become vulnerable. So that could be the other aspects on it. You could win an Olympic medal in 45 minutes, 36 to 45 minutes, depending on the draw. So that's over 17 days. So each time you're medically assessed after those 9 minutes, you go back in, your fitness to box. While in pro boxing, you're in an awful lot longer. So there's other aspects to it as well. It's not that simple. So looking at the stats now, these are older stats from 1993. This is US Olympic training camp data, but this kind of ties up very closely with the current data we're seeing. Ours are slightly different. UK have looked at it, but this is still a good study, even though it's older. Roughly about 28% of injuries are to the face and head. Concussion is about 6%. I think that's ranking very high. I think that's a very high rate. We'll show you some other arguments for or against that later. Upper limb, 36%. It's majorly an upper limb sport, obviously. So the shoulder and the hand are the key aspects here. And there's a couple of key things we can argue for today to prevent those injuries. Hand is about 18%. 1 in 5 injuries. 1 in 5 injuries is the hand. And we need to try and put out fires or stop them before they occur, and there's certain things we can do to prevent hand injury. Spinal column is low, 14%. I would certainly agree with that. I would think it's probably lower. 1 in 10 of the guys that we see, well-conditioned athletes, boxers tend to be very well conditioned and often strong in the back and stomach muscles, of course. Lower limb is about 22%, with ankle accounting for about 12%. Ankle sprains, probably. Right? Okay, incidence of injuries in boxing. Have a look at this statistic. This is an Irish one. This was carried out here in the stadium. This is a very nice study. I think the data is a little bit outdated in terms of maybe the volume now, but roughly the average boxer was suffering back in Porter's study in 1996, 0.7 of an injury. Less than one per boxer per year, right? 19 days average affected by that injury. So obviously that average will go up if you got a fracture, that average will go down if you got some muscle aches or bruising. Your general sport was 2.0, carried out at the University of Limerick. And on average, this was Irish average athlete. This is athletes across the board, rugby, Gaelic, soccer. It was 52 days they were affected by it. Okay? Recent data probably says, the problem with this is per boxer per year, we should really try to record injuries per 1,000 hours of risk. That's the way we standardise it. And injuries in boxing are about 2 per 1,000 hours of exposure. That would be, we need to take, that's not 1,000 hours in the ring. That's 1,000 hours of training. Is that fair? So it's actually quite low. If you're a basketballer, you've got a 2 to 3 times chance in 1,000 hours you're going to tear your ACL. So just one injury in basketballers accounts for nearly 2 to 3 per 1,000 hours. All of our injuries are about 2. So boxing is a low-risk sport. It does contain certain issues like the concussions that we're going to talk about. We're seeing about 1 to 2 injuries per boxer per year. Many of them are traumatic, sudden onset, and some of them are overuse. Right, so what can get injured? Obviously tendon. We don't see tendon tears in boxers regularly. Maybe a couple at the wrist. I think we've seen 3 in about 14, 15 years. Okay, and we haven't, the tendon itself, there is an exception at the hand, I'll show you that in a minute. Ligaments, of course, we don't see an awful lot. The ankle, maybe. Vertebral issues, the spine, disc. We've seen a couple of minor disc issues. I think if you looked at boxers, you're going to see a lot less disc problems in boxers than you will in an average population, because they're fit and they're strong. Nerve injuries, we've seen a couple, not major. Abdominal injuries, like spleen injuries, we haven't seen. I've seen them in rugby. I saw a guy who lost his spleen on a pitch one day from a tackle. Face, lacerations, bruising, and of course the brain. Okay. Right. Extrinsic risk factors. These are the things that we can address that are outside of control of the actual boxer, directly outside his control. So violence in sport, as we know, it's quite common. In boxing, it's an extremely well-controlled sport. I've seen guys in the same dressing room punch the heads off each other. On pitches, you see it happening. In boxing, it's a sport of honour. So it's extremely well-controlled, and I think the code in other sports could actually learn from that. Rules, the application of the rules. That's very important, and again, we talked about medical control of boxing. Drugs in sport, particularly anabolic steroids, can change behaviour, increase aggression. It tends not to be a big issue. Anabolic steroids tends not to be a big issue in boxing. Why would you think? Yeah, because it puts the weight up. It puts you out of your class category. So it tends not to be the biggest issue. It is obviously in sprinting and power sports. So ring and training facilities, very important. We did have one training camp where one of our boxers, the heavyweight I think it was, went through the floor of a gym. The gym floor actually gave way and his foot went down and he sprained his ankle. So obviously the quality of the gym, training on concrete floors could be difficult on the knees, things like that. So the canvas being tight. Environment, lighting, that's very important. Lighting is very important. Boxers because they're often fighting close in, they use peripheral vision, their wide vision, to actually balance themselves. So a well-lit surface or a well-lit area is important. Obviously they look at they use the ring ropes to actually help to balance themselves and orientate themselves in space. Protective equipment, very important. Gum shield, head guard. And just look at this design of the glove. That small little piece of material on the glove prevents so many thumb injuries. This came in, I don't know what year that came in, you might be able to tell me, but this is vitally important as a design of the glove because it prevents fractures at the base of the thumb. And that's absolutely made a huge difference. So protective equipment, high-top boots, maybe ankle straps or ankle braces if the athlete has had an ankle sprain in the last 6 to 12 months. And inadequate treatment is also not treating something early enough or not treating it correctly. Right? Intrinsic inside the boxer, how you can prevent injury or reduce the risk of injury is balance, absolutely balance. Balance has been shown in research to be one of, if we have poor balance, we're more likely to get injured. And boxers tend to have very good balance. Well, certainly in our testing of the HB guys, they score high because of the type of drills that you're teaching. And also it's a lateral sport. They're moving laterally, and so they're on and off one leg. The actual sport itself improves their balance. But I wouldn't negate the importance of balance in terms of your training and your drills. Flexibility is not a huge risk, is not a huge predictor of injury. So if you're tight, muscled or jointed alone is not usually a risk, a particular risk. It does contain some aspects, but it's not the single biggest. Posture can play a role. Ask your boxers, can they self-correct? Can they pull their shoulders back? Can they bring the shoulder blades back together? Often this position, if they're hunched there and they're like that, they probably have a tight chest. Posture integrated with movement and biomechanics are probably what are important. They're skills, basically they're skills, and they learn those from a very early age. Fitness, coordination, fatigue. So if you're trying to teach a boxer something very new, you probably want to do that at the start of your session, not when he's fatigued. It's very hard to learn something when they're fatigued. But good conditioning. This is really where boxers come into their own. It's where you guys are the geniuses in it, conditioning of athletes. There's so many other sports. We've had some other sports come in and train here, and they just find their training so tough. It's four-limbed, it's non-stop. So the conditioning of athletes is very important. Plenty of rest, as well as plenty of sport. Okay? And sleep. Your athletes, especially your junior athletes, need 1 hour more sleep than the average person who doesn't play sport of their age. They need to turn off their laptops at night, turn off their iPhones. They need to go to bed early and recover well. Previous injuries not healed. Previous injury not healed or a current injury, you're much more likely to develop another one. Strength, etc. Right, hands. Briefly on hands. So we're looking at hand and wrist and thumb here. Fractures, sprains of the joint, ligaments, knuckle and the extensor hood. I'll show you that now in a minute. The boxer's knuckle is what we call that. There's a little tendon going over the top of your knuckles there, and there's a very small, probably 1 millimeter sheet of material holds it down. That often gets broken because of a cross punch across the knuckle. As he lands the punch or she lands the punch, it pushes the hood and it can tear it. And we call that boxer's knuckle. Most complicated, hand injuries are most complicated. They really affect performance. They put the athlete out for a long time. They're time consuming in terms of recovery, and the cost is where the cost starts ramping up. So you're talking about, physio may be expensive or not, but medical care and surgery is just 20 times more expensive. You're talking for a surgery, you could be talking 1,800 to 3 to 4 grand for a surgery on the hand done by a plastic surgeon. So they're expensive. Most of the things I would say, if you do have an athlete with a hand injury, we have, despite the bashing that the health service gets here, we have a very good emergency service generally in Ireland, and orthopaedics is excellent. Send your athletes through A&E. That's the best way. They can't wait, they have to treat them. You can't wait for somebody to get a pin or a plate put in. It has to be done. Does that make sense? Yeah. They don't go in a waiting list for the pin or plate, they have to be done. And they'll usually be done quite quick. Okay? Right, here's a scaphoid fracture. We've seen a couple of these. So maybe two of them. These are nasty little fractures, and the problem here is if these go missed, the blood supply to the bone can degrade and the bone can actually die, physically die. And this is a nasty. Often this is pinned. This is a fracture here in a boxer who had to have pins put in. This was a rotational fracture. He broke the second and third. And these are called boxer's fractures. And you see the spiral movement on the bone here. That's usually the sign it's a punch injury, okay? As opposed to a fall, maybe. A fall, the bone will often snap directly. With a punch injury, it's often spiral. So this is the boxer's knuckle. You can see the thickening over the knuckle. Many of you have that. You have it as a response to the stress gone through your hand. But the little tendon here the hood can get torn. Many of these need to go in a splint for 3 weeks. Some of you have had these, and most of the ones we've seen have recovered with physio alone, a medical review, but no surgery. We've had 2 surgeries and probably 30 to 40 of these injuries. So the problem is surgery is they'd be out for 3 to 6 months. Here's the base of the thumb fracture. This is the extensor hood. You can see that's the tendon looking down along the finger, and the tendon is now slipping off the top. These become awkward and painful. And this is just a pinning of the bottom of the bone of the knuckle. So what can we do? Prevention. Hand wrapping is vital. That's it. It's hand wrapping. Good, judicious hand wrapping. And you may have 20 boxers at the gym. You can't wrap them all. So you need to obviously give the responsibility to the boxer. You need to check them, teach them and check them regularly. Right, so the other thing is boxing technique, and coaching is absolutely vital. We see recurrent injuries in the hand because of their technique, and it really is obviously not my area. It's the expertise of coaching. So an awful lot of hand injuries when they're returning, our prevention of them is by the teaching that you're doing with them. When they start fatiguing at the shoulder, they'll try and land the punch any way they want. Getting sloppy, just throwing random punches, or getting irritated, they'll just throw them out. So obviously coaching them with technique, training, frequency, intensity, time. Too much training, too much loading on the hand on a young hand. The hand is not designed to repetitively take impact like that. Hence the glove, hence the wrapping. So we try to reduce the forces. But the hand can learn to take those forces. So too much training or too little training. So giving them plenty of breaks, mixing it up a little bit, doing some hand work, then doing some footwork. Body control. So if you're weak at the shoulder, you're gonna have to land that punch somehow, and often they start moving the hand and wrist within the glove. Fatigue. Previous injury and poor hand wrapping or inadequate hand wrapping. So the main points for the hand is wrist to hand, knuckles and thumb. Allow for slack, so often don't over tighten it. You don't want to cut the blood flow to the hand. Crisscrossing. Crisscrossing creates cross braces across. Basically what you're trying to do is to compact the hand. And then when they close their hand, it actually, it's held together. Just be careful of too much wrapping underneath to protect the knuckles, because the hand will be out like that. So what you can do is pad over the knuckles with some wrap underneath the palm. But too much wrapping on the palm, and we see athletes doing that, and their hand is out like that. And that makes the knuckles more vulnerable. Does that make sense? Knuckle padding, securing the wrap. You'll see here that he's got quite a lot of thickening over the knuckles to protect, and that'll protect the forces going down through the hand. Right, firm, not too tight, dry and in good repair. If they're old wraps, they need to be thrown out, and they need to be dry. Use double wraps, foam, sponge, cushioning for knuckles. Darren won't mind me saying this, he's one of the best to watch the hand wrap. He really pays a lot of attention to it. This is Darren. He's used 2 wraps here and some foam. It's just, we've felt. It's orthopedic felt. But you could use sponge. Wrap over the knuckles and in to hold it in place. So it cushions the hoods and it gives some impact protection. Use double wraps, foam, and quality gloves. Obviously quality gloves. Gloves that are old need to be thrown out. No more than runners. You're the experts in knowing when a glove is going, but if it's starting to go, it needs to be replaced. It needs to be thrown out, not put away and said, well, we'll only use that for a certain thing. Bags and pads, no, it's the same thing. Boxer practices wrapping, forms a routine early on, and you hand the responsibility to the boxer and you recheck them, because you can't wrap everybody. Okay. Hand injuries are common in boxing. Individual boxers are responsible, but they can be prevented. Right, shoulders. About 7% of injuries were to the shoulder. We think that's higher. We think it's about 10%. It's the 3rd most common injury in boxing after face, scalp and hand. And I almost would say many of you are dealing with athletes at the moment who have shoulder injuries. Am I right about that? Many of your younger athletes? No? Yeah. Good news is most of these are not serious. That's the good news. Certainly from our data and most of the data. Right? There's force applications going around the shoulder. Our shoulder is so mobile. It's so mobile. For what we gain on the mobility, we lose on the stability. The hip, I don't have as much movement of my hip, right? But I've got great stability at the hip because it literally sits right into the socket. The shoulder, what we gain in range of motion, we lose in stability. So we've got these forces going through the shoulder. So it's the muscles around it that protect you. That's it. And the health of two of those muscles is particularly important. So the deltoid, the large muscle on the outside of the arm here, causes the shoulder to shear. And it's shear that leads the shoulder to risk. Okay? And the smaller muscles around the shoulder reduce that shear. And this one, the external rotator, the infraspinatus, some of you may know of that, the infraspinatus, but external rotation, if you're not strong for external rotation in a boxer's shoulder, it's only a matter of time before he will develop a problem. And he'll feel it here, he'll feel it in his shoulder usually, deep in the shoulder. Right, this is our own data, 1 year before London Olympics and 1 year after, senior boxers, total of 25 boxers, and we had somewhere in the region of 22 injuries on the shoulder. Now that's a lot. But have a look at this. 15 out of the 22 were purely muscular. Oh yeah. So we're purely muscular. And what we found is that these could be recovered really fast, very little medical care, 1 to 3 treatments, they were good. Is that okay? And then we had tendon problems down the way. What we're saying is the majority of these injuries were purely muscular. Okay? We had a dislocation, which was an unusual one. It did happen. That boxer's back, had no problem returning. And we did have another dislocation in a youth, but that was from a fall. It had nothing to do with the actual boxing itself. Tendon problems, but labral tears. Right, fatigue resistance. If you don't have fatigue resistance, so external rotation is that movement. If I'm weak for that movement, that's my risk. And you have to maintain that strength. In normal individuals, that strength compared to internal rotation is 66%. In professional baseballers is 75%, and our boxers are running at 80%. So they have 80% strength going out, 100% strength going in. It's the ratio of out to in that matters. I'm going to show you 2 exercises that would be wise to incorporate in your training. This is it, external rotation, done like this. This is just a demonstrated exercise. And your reps are roughly endurance reps, 10 to 15 repetitions, 1 to 3 sets, depending on the age group. 2 up, 4 down. So 1, 2 up, 4 down, 1, 2, 3, 4. Really important to do it light initially, and frequency is 2 to 3 times a week. Concussion, it's the big topic. Recognize and remove, that's it. Most important thing is the boxer has proximity to you as the coach. You play the most important role here. So the coach, other boxers, and the family are the ones who are going to recognize the changes in the boxer. It's the proximity that you have, the contact that you have with the boxer, listening to the mum saying, you know, Johnny's not feeling well, listen to that. And you're already, I presume, seeing some concussion, am I correct? Do you see a lot of concussion? No. So the question is it not present or are we missing it? Okay? I think concussion isn't being missed that much, I believe. I really do believe. I think it's a very safe sport in that terms, but we cannot be complacent. So concussion is a traumatic brain injury that results in usually a temporary impairment of brain function. And it's a brain injury. We can't get over that. It is a brain injury. MRI is usually normal. It's usually normal. This actually is this here is a subdural hematoma on an athlete, on a boxer. And this is the resolution of it. You'll see the swelling here, and then it's gone in this image. It took about 4 weeks to resolve. This was from a clash of heads. Okay? It's been written up in the journal here by Dr. Aina Falvey from the sports, he was a boxer, as you know, sports surgery clinic, right? Second impact syndrome, this is what is important, is if you have a boxer with a concussion and it's not recognised, and they get a second concussion on top of that, there is a rare but significant chance of a catastrophic injury. They could die. So you have to recognise and you have to remove. There's no ifs or buts about it. The player welfare is the most important thing. It is rare. CTE is a chronic traumatic encephalopathy. It's developed over time. So concussion causes direct blow to the head, indirect forces to the head. So you don't need to hit your head. The athlete could fall and shake their head. I've had 2 concussions in my life and neither were from boxing. One was playing rugby where I got a blow to the head. I was 12, 1982, and it got picked up straight away and I was out for 28 days. I mean, in 1982, they did the best practice. I was surprised looking back at it. And I fell off my mountain bike back in August and rattled my head, never hit my head, and a concussion for 4 days. Dizziness, blurred vision at times, you know, like migraine symptoms. Okay? So you don't need to hit your head. Whiplash patients often don't hit their head. So head rattle, a head roll, direct punch, head-to-head clash of heads, head jerk movements, a sudden blowback, or he goes to avoid the punch and he moves his head back. He could get a rattle from that, or she. Concussion, again, 6%, though we think that's quite low. Here's a couple of statements. The incidence of concussion is comparatively low, UK 5-year study. That's UK, Loosemore, just published. They're basically saying it's low. Amateur. The majority of impacts experienced by both genders, male and females, were under the threshold even to induce a mild concussion. So most blows your boxers create on the other guy's head or the other girl's head it does not meet the minimum requirements to induce a concussion. Just be aware. Doesn't mean it can't. Okay. Amateur boxers participating in multiple bouts during 7-day tournaments say no evidence of cognitive dysfunction unless they've been if the boxers, there were 7 of them who were stopped by the referee, and they did show some slight changes. So in other words, if somebody gets stopped, somebody gets a count, you need to check them. You need to monitor them. This was done here in the stadium. We have 2 great studies, another one here. 9 years, they showed, over 9 years, these boxers showed no changes in cognitive function. Consider the accumulative effects over time. So we don't really know what the accumulative effects over time are. More data is needed, but it looks relatively good. There might be some slight changes. This study data support the opinion that current IABA headguards can play an important role in reducing the risk of concussion. This is just published, and I'll give you that data quickly. Bayer versus headguarded, forehead impact, 130 Gs versus 85. There was 35% less force going through the head with the headguard. That's in a front-forward punch. In this one, the angulars, and it's the angular accelerations that are the dangerous ones. It's the bang with the acceleration to the side. So it's the side, temporal head, knee to the head in rugby, Gaelic football, elbow to the head, things like that, where there's rotational forces. These were 50% reduced with the headguard. 50% reduced. Despite that, there's still controversy. Mike Loosemore, who is back, we just saw him, the UK doctor, said that removing the headguards may change risky behaviour. That may be true. It may not be true. It depends how they're coached, depends how the rules are impacted. But just be aware, there are advantages of headguards. They should be worn in training, which is the standard now, isn't it? Yeah. Right? Presentation of usually occurs within 24 to 48 hours. Stop, inform, rest, return. Okay? Stop. You stop them. They stop them. They inform. You inform the medics, and then the medics or the physios, etc., will take them through the rest and return to play protocols. We'll give you a copy of these slides. You'll have all this. Your physical, sick, headache, balance, dizziness, irritable, emotional, cognitive, sleep, various different things. And they can come at different, they can come and go. Migraine type symptoms, that's what they'll often look like. Concussions, the signs, the things you observe is loss of consciousness, behavior change, not feeling bright, vomiting, drowsiness, memory loss or confusion. Movement changes, they look sluggish. Or they tell you, I just don't feel right. I feel tired, I feel like I got a flu. Dazed, blank look, balance difficulties. When they get out of the ring, say to them, what did you think of the guy you boxed? See, can he remember the boxer's name, what country they were from, or what club they're from? Boxers know those things. We were here one night at the stadium, and I remember one of the boxers came out and he said, Jesus, that fella was tough. I said, yeah, he was. And he said, I said something like he was Romanian, and he said, no, he was Hungarian. I said, no, he was Romanian. And the boxer got around it, excuse my expression, said, well, he was an ugly bastard either way, excuse my expression. That's what he said to me. That was a red flag, straight away. That's what he said. He was in Tala Hospital that evening, and he had a mild concussion. So Romanian or Hungarian, it came down to what the guy looked like. But he didn't know, he wasn't sure what year it was. Okay, they're the things you need to look at. They're rare, but they're possible. If you see a face injury, consider they may have a concussion because a blow went through the head that was enough to cut the skin. If they got a count or if the fight was stopped, they should be checked. Ask them simple questions like, what did you think of that? What was the score? Orientate them. Check them. Is there anything you're hearing or not hearing from them that's strange? Nearly there. So, stop, inform, rest, return. That's concussion management. The return to play protocol is basically, absolutely, they must rest for 14 days. Complete rest. Nothing. No training. That's it. The brain needs a rest. Actually, they shouldn't even be on computers. Many people should, if they're working, they should stop working. I've seen 2 really severe concussions, one with a brain trauma, and 6 months later she still has deficits from a fall off her bike, and we have another guy who fell off his bike and it was missed, and he said to me in the clinic one day, I'm treating his back, because he injured his back, he said, I'm much more emotional than I usually am. That was the red flag. Sent him straight to the hospital. He was out of work 2 weeks. He was walking around with that concussion for 3 weeks and doing very high grade work at his computer. The brain needs to rest. The standard IRFU guidelines for under 20s is 8 days plus the 14. That brings you to roughly about 23 days and 6 days for adults. Okay, you need to be aware in boxing, the boxing rules are very clear. Here's rules, IABA technical rules. You need to be aware. It says 30 days. And you know that it goes up from there. You're aware of that if you loss of consciousness over a minute, etc., it changes. Now, I'm not here to critique those, but we need the best science. Resting a guy for 6 months because he had a loss of consciousness necessarily wouldn't be the best science. Does that make sense? You test his brain. And in high performance, we're using the SCAT3, which is a form that we use, a medical driven form, and we test their balance, number recall, word recall, and we use a CogStat, computer testing, which is like a computer game, a game of cards. And it'll time them and it'll compare them to normatives. Almost there. There's the IABA technical rules, okay? They'll be on site. You can look these up online anyway. This will be on the package for you. 30 days, 1 minute is 90 days, greater than 1 minute, 180 days. And this applies to competition and training. If you get an athlete who's injured in your gym, and the responsibility is on the coach to report that to the National Federation according to IABA rules, you have to report it. Okay, it can't go unnoticed. Right. Hand hygiene. Why would I even bother about that? Here's the thing. They looked at the Olympics, Irish Olympics, and they said the biggest single reason an athlete will not be able to partake in their competition, not boxers alone, this is across sports, athletes, everything, is down to getting a chest infection or getting a gastric problem. It's the biggest single threat when they enter competition. They're under stress, their immune system starts dropping, and they're vulnerable. The biggest thing you can do to prevent that, and you need to tell your boxers, is to wash their hands. That may seem simple, but it's an absolute. If they transfer a bug, that's how they're going to get sick. That's why Johnny or Billy gets the chest infection or the gastric problem, starts diarrhea, and they can't partake. It doesn't happen as much in boxing, it happens a lot in other sports. A lot. Wash their hands. Wash their hands. They need to wash their hands. Ask them to smell the glove. Gloves don't smell like vanilla. What is the smell? It's the waste product of bacteria. So when they come out of that, the good thing in the glove, they can't put their hands in their mouth. That's the good thing, right? But when they come out of the glove, the first thing, or when they're showering, etc., they should wash their hands. And you're much better using alcohol. For your athletes traveling or coming close to competition, they should really be using alcohol sanitizer. It may sound simple, but if you've had an athlete who's got sick close to a critical point in their career, it could be prevented by this. So if you want to start putting out fires, a little change will give you a much greater payoff. The other thing I accept, they have immune system dysfunction at times of high training. You know, they're a little bit more vulnerable, but all the more reason you need to wash their hands. If they're traveling, don't share water bottles. of course, for many reasons. Clean fruit properly, make sure they drink bottled water that's sealed, stuff like that. And there are some simple things. Anything to take from today? Hand wrapping. Some shoulder exercises. Most shoulder problems are not serious. Most boxers can get through them very well. Concussion is a serious issue. We need to deal with it. It's relatively low risk, but we can't be complacent about it. And we need to do the best for the athletes in terms of their welfare. Coaches play the most important role in that and identifying it. Last thing, hand wash. Simple things to put out fires. Thanks very much.